The rise in non-communicable diseases, or NCDs, worldwide, particularly in the Gulf and Middle Eastern regions, is attributed to changing lifestyles and increasing risk factors such as physical inactivity, unhealthy diet and tobacco use. According to the World Health Organization, the NCDs are projected to rise at alarming rates in the near future and are the leading cause of death across the globe. In an effort to further improve prevention and control of non-communicable diseases, Dubai holds the first ever Non-Communicable Disease Congress. Our correspondent Khadija Saleh has this report.
According to health experts, mortality rate resulting from cardiac incidences in UAE state hospitals was at 30% 3 decades ago. At present, it is now between 2 to 3%, a significant improvement. However, non-communicable diseases still make up 67% of the total number of mortalities. UAE Minister of Health, His Excellency Abdul Rahman bin Mohammed Al Uwais said, health is among the UAE's main priority, and the first Non-Communicable Disease Congress aims to further strengthen control and prevention of NCDs.
Hopefully, based on what we saw and what we will see, in this conference, and with the support and the more coordination between the Ministry of Health, the Health Authority in Dubai, both health authorities in Dubai and Abu Dhabi, hopefully we'll see a far bigger, more focused program on discovering the early stages, and based on that we will work on preventing our population in here from having those diseases instead of treating them.
The event will see the participation of more than 650 health and medical specialists from across the globe to discuss NCDs and exchange best practices. The United Nations General Assembly Political Declaration in September 2011 identified chronic non-communicable diseases such as diabetes, cancers, cardiovascular diseases, and chronic respiratory diseases as a threat to socio-economic development.
It aims to translate the recommendations of the World Health Assembly and also of the United Nations General Assembly Political Declaration on the prevention and control of these diseases into some concrete action for the United Arab Emirates. Problem is increasing in magnitude. Cardiovascular diseases, diabetes, cancers and chronic lung diseases are increasing in magnitude in all countries of the region, in the Gulf and also in the other countries of the Eastern Mediterranean region, and there is a pressing need to develop a national strategy and a plan to address these problems. These strategies and plans have to be multi-sectoral. This is not just the responsibility of the Ministry of Health. Other government sectors will have to be accountable and will have to be responsible for implementing the strategy. And also it's the responsibility of civil society, the communities, and also of the private sector.
NCDs account for over 60% of all deaths, with 80% of such deaths occurring in regions including the GCC and the Middle East. At present, it causes 55% of all deaths, and over the coming decade, the region is expected to experience the second largest rise in the proportion of deaths to NCDs.
The main thing that we have here to do is to implement a healthy lifestyle. We have to know what to eat, we have to carry on doing the exercise, and very, very important is smoking. Smoking is a big hazard in this country, and now with the increase of this shisha coffees shops, this is a very big hazard for the community. In addition to the fast food restaurants, which you find it now in every corner, so these two, there should be some restriction on them in order to develop a better, healthier new generation.
On the sidelines of the Congress is an art competition held among students to raise awareness and educate the youth. Experts say NCDs are preventable. However, the challenge lies among the choices we individually make. It is hoped that with the increasing level of consciousness and available information, non-communicable diseases will no longer claim lives. Khadija Saleh, 7 National News.